We would now like to invite our final presenter of this session, Dr. Kristiantini Dewi, Chairwoman of Dyslexia Association of Indonesia, to present her research on Indonesian early identification system.
Okay, good morning, everyone. It's a pleasure for me to be here again in Unite SPLD 2017, and as I was also here last year. So today, kindly allow me to present Indonesian Dyslexia Early Identification System, which was found by Dyslexia Association of Indonesia, collaborated with Telkom University as the expert of IT program. So as we already know that dyslexia is a specific learning difficulty, mainly in language areas such as language for oral language, written language, and also social communication skill. And also dyslexia causes difficulties in reading, writing, math, as well as executive function. And these kind of difficulties may lead or impact not only to academical achievement, but also impact one's self-esteem and social emotional development later in his life. And although we know that dyslexia is not something curable, it remains there, but that doesn't mean there's nothing we can do about that. Many research report that whenever we are able to do early identification and early intervention, then the impact could be significantly reduced. And being outstanding later in his life is not something impossible, of course. And there's a unique problem in my country, Indonesia. As you know, Indonesia is a very big country. It has a huge population that brings a high number of dyslexic learners. And this high numbers is really, really high, as I mentioned earlier last year, that Indonesian population hits more than 250 million people. So it brings estimated number of dyslexic learners in Indonesia would be much or less twice of Singaporean population itself. Yeah. So come to Indonesia. And unfortunately, we are still struggling with minimal or unequal dyslexia awareness in conjunction with very few dyslexia experts who are mostly available at big cities of Indonesia, mostly in Bandung, where we stay, and in Jakarta. So it is so a time and cost inefficient for people to get assessment or intervention from reliable source, and these difficulties lead to unintervened dyslexia cases or ignored cases of dyslexia, and then prone to have poor long-term outcome in the future. And this is really something that we don't want to happen, of course. So we strongly feel that we need valid, reliable, yet easily accessed tools, especially for preschool age children in Indonesia. So this study evaluates a computer-based screening identification system that is applicable for children from 5 to 7 years old, which is easily accessed by everyone at anywhere and anytime, as long as there is internet connection. And later on, this is also some problem in some cities because there's no internet connection available. But then this computer-based identification system will generate report within a line of Indonesian language and culture. The way of completing the method is by completing the questionnaires. There are 21 questions for a child of 6 to 7 years old year, and then 17 questions for children of 5 to 6 years old. And these questionnaires can be downloaded online from certain websites via a personal computer or smartphones, and the result would be risk or no risk of dyslexia. And the main screening parameters are aspects that influence or impact the condition of child with dyslexia. So the screening parameters are child identity and background, parents' background, academic ability, and non-academic ability. In academic ability, we ask about oral language, written language, social language, and numeracy ability, while in non-academic ability consists of organization, sequence, direction, working memory. So these questionnaires, they assess not only pre-reading skills but also executive function skills. There were some stages when we do the study. The first stage is the preliminary design, where we develop the model of the assessment for identifying risk of dyslexia. And the second stage was the system design and implementation, where we describe the method proposed and the rationale behind its choice. And from table 1, we can see the significant difference between the assessment that is done by the expert manually and the assessment using the proposed system based on computer. And the difference covers the duration-wise, time-wise, place, and also the procedure for identifying children at risk for dyslexia. And we can see that the assessment using proposed system based on computer is significantly more effective comparing to the assessment done by the expert manually, because it's shorter in terms of duration. It could be done whenever and wherever as long as there is internet connection, and of course the procedure more simpler because the patient, they don't have to see the expert himself. They just fill in the questionnaires and the system will identify whether the child has risk or not dyslexia. So in figure 1, we can see here there are some processes that had to be undertaken in order to design the instrument and scoring the method. These processes were determining the objective of the instrument, arranging the parameters, and also writing the questionnaire, identifying the scoring technique, and also determining the scoring guidelines, piloting the instrument, and then evaluating whether the system is useful or not. And in table 2, there are some signs and symptoms of dyslexia that already have been identified internationally in UK and in USA. And then we take some of them within the line of Indonesian population of dyslexic children. So based on this table 2, we summarize some characteristics of dyslexia, and then we make it as the basis of the design for our parameter of dyslexia children in Indonesia. And then we have to check the validity of the system, and then the respondent for the piloting instrument is in the outline of the table 3. And we can see here that we count the true positive, false positive, true negative, and false negative, and then we found that the accuracy was 79%. And then we also analyzes the sensitivity, specificity, and the accuracy as shown in table 4. And we have 3 schools here, and Indigrow is a small-scale special school for dyslexic children. So all the students here are dyslexic, diagnosed by pediatrician, by the authors. And we can see here the value of sensitivity is higher at the Fitrah Insan Elementary School than the Nilem Elementary School, because there's a higher false negative in Nilem Elementary School than the Fitrah Insan School. And the total sensitivity is 81%. So that meant if we conduct this computer-based identification system to a child who are at risk of dyslexia, there's an 81% chance that the child would be correctly identified as a child with risk of dyslexia. And for the specificity value, here we see that Nilem Elementary School has higher value of specificity, and that's because we don't have any false positive false positive in the Nilem Elementary School. And in Indigrow, we cannot calculate the specificity because all the patients are dyslexia. And we can see here the total specificity is 93%. That meant if we conduct this screening test to a child without risk of dyslexia, so there is a 93% that the child would be identified as a child without risk of dyslexia. And the total accuracy was 84%. The study also used the ROC analysis, which its space depicted in this figure 2, and its trapezoid shape means the area under the curve is quite large, and means that the screening is good. And based on the formula, the ROC curve was 0.87, which indicated that the screening test has good accuracy to identify whether a child has risk of dyslexia or not. So, despite of many limitations in the study, probably we say that this Indonesian dyslexia early identification system is quite valid, reliable, sensitive, specific, and accurate, and it is easily accessed anywhere and anytime as long as there is internet connection. And then we already spread these tools to many cities across the islands, and many of them report that the limitation is due to the Wi-Fi or the internet connection. So this is the website where we can download it online free, the www.nbdcenter.com. So thank you for listening.
Thank you, Ms. Kristiantini. It's great that now the application can reach more areas which are inaccessible. Got to get the Wi-Fi through. All right. We'd like to invite Ms. Insan to present a token of appreciation to Ms. Kristiantini.